So as I met with my colleagues in Army, Navy, and Air Force, Joint Chiefs of Staff, and I said, hey guys, you don't understand. This isn't just my problem, it's your problem. They said, oh no, Surgeon General, this is your problem. We don't have. I said, it is your problem. I said, it's a national security problem. He said, how could that be? I said, well, let's look at the data right now. For our soldiers, our sailors, our airmen, Coast Guard men and women, the number one cause for failure to be retained on active duty was obesity. They couldn't pass their physical fitness tests. And you're now trying to recruit to get more people to protect our communities and our nation, depending on, no matter what uniform you wear, same thing, you need smart people who are physically fit. I said, so that's the problem we have today. And I'm telling you, the next generation that's going to fill their shoes is going to be more sick, more obese, and won't be able to pass your test. So what does that say for the security of our communities and our nation? So now health is clearly seen as a national security issue, and chronic disease is one of those things that is causing us significant problems in not being able to be fully prepared. Because as a nation, as a community of Manchester, as a state, and even as a nation, our ability to be maximally prepared for all hazards, whether it's man-made or whether it is naturally occurring disasters, is directly related to our level of health. And the higher degree of chronic diseases we have that burden our society, not only because we can't get providers to take care of us, but because more sick people then have to be cared for during those emergencies. Look at what happened in Katrina with all of the elderly, infirm populations that you have to move during a time of an emergency. So you start to see that this disease burden extends out past where we are. And the cost to society, whether it's Manchester or whether it's the state of New Hampshire or whether it's the nation at large, is astronomical. You all spend directly and indirectly about $5 billion a year in the state of New Hampshire, $1 billion directly for healthcare, chronic disease, and $4 billion in lost opportunity. That is absenteeism, presenteeism, big loss, and most of it is preventable. So when I look at prevention and preparedness, directly intersecting with the challenge of chronic disease, obesity being a big driver. And then I dealt a lot with health disparities. The fact that we're still a nation divided by our health metrics. That if you're Hispanic, Native American, African American, or a lower socioeconomic group, chances are you are going to have a higher disease burden, you will die sooner, you will cost society more as you move toward that death, and the last few years of your life are probably going to be very expensive, very painful, and will have been robbed of quality. That was a big struggle too, because a lot of people had different ideas, not understanding the socioeconomic implications of all of this. And in fact, if you want to see the most health disparities in our nation, it's not like where I grew up in Harlem in New York City or East LA. It really is our Indian reservations. The highest incidence of obesity, highest incidence of diabetes, highest adolescent suicide rates, and some of the highest rates of chronic disease are on the Indian reservation. Largely because these once healthy populations have been moved to the most desolate areas of the country and forced into a Western society. What's ironic is that in 1900, when the American Indians still had some of their culture retained, they're hunter-gatherers, they ate organically, they ate healthy foods. They were physically active every single day. Obesity was unheard of in the Native American population. Diabetes was unheard of, and now the highest incidence of obesity and diabetes are in those Native American populations because they became westernized. And so I think one of the greatest tragedies is not the Indian Wars with, back a century ago, but really the real curse was them being forced into a Western lifestyle and being robbed of their culture, which today results in huge costs of health care to these fellow Americans and health metrics that are just disastrous, and a lot of it is chronic diseases that accumulate. So the average Indian now, depending on which reservation you look at, lives 10 to 20 years less than the average American. In 1900, the average Indian lived into their 70s and 80s when the average American lived 48 years. And now that's reversed itself. So you can see. And as we look globally, the same challenges are occurring. That's okay. Make yourself comfortable. As we look globally, we see the same challenges before us around the world, because a lot of these issues, especially chronic disease as well as other challenges, don't recognize our geopolitical borders. Whether it's avian flu, whether it's smoking, whether it's obesity, whether it's SARS, whether it's any of the other challenges you've read about. Geopolitical borders are kind of meaningless. In fact, you can get on a plane any place in the world and come to the United States, and you're here before the incubation period of the disease that you're carrying. And all of a sudden you become a vector and spread disease, and there's no way to tell. So we have to start looking at things a lot differently. I was just invited to Japan a few weeks ago, and I was asked to address the Japanese Parliament, which is kind of our House and our Senate equivalent. And I met with their leaders, and they asked me to come out because they said to me, you know, we're really concerned. We're starting to look a lot more like Americans than we think we should. We're getting heavier. We have more cardiovascular disease. Our obesity is a problem. We're developing chronic diseases. It's costing us a lot of money. Yet the Japanese only spend 8% of their gross domestic product on healthcare. That's half of ours, and their health metrics are better. They live longer, and they live healthier. We spend 16% of our gross domestic product, and yet with that 16%, we are ranked anywhere from 35th to about 50th in World Health Organization metrics as to quality of life and so on, life expectancy. So there's a lot of work we have to do. The real point here is that chronic diseases are debilitating our nation and, in fact, the world. The increasing disease and economic burden are extraordinary, and our partnership to fight chronic disease is here because we feel that in a nonpartisan way, we want to bring all organizations together to be able to address this issue. We want to hold our elected officials accountable, from the presidential candidates right on down to local officials, as to what they can do about this. A lot of it is, as you're doing in your communities here, mobilizing people, staying physically fit, eating healthier foods, making better choices. And so, you know, as Surgeon General of the United States, I recognize very early on, as having come up from the community and to a national level, the real power of the nation, it's in its communities. It's not the Surgeon General writing a memo and saying, you know, everybody should get healthy and this is bad stuff. It's really all of you take action and model those best practices. I was smart enough as Surgeon General to be able to look around the country and borrow your best practices and incorporate them. You know, it's no mistake that we send CDC people into all the health departments around the country because we want your best information. Okay, because all disasters are local, all health challenges are local, and often it's you all that figure out the best ways to be able to tackle these problems and improve the health status of a community, which then can be sent up, thanks, appreciate it, and then be projected out. So the Partnership to Fight Chronic Disease currently is 110 organizations. We would ask all of you in your organizations, please join us. All your 3 major medical providers here who are preeminent and, you know, do such a wonderful job. Go to our website at www.fightchronicdisease.org. Look at the information we have. We provide, you know, free of charge to you information that can give you guidelines as to how to improve the health status of your community, a roadmap. There's essential elements of successful programs that we publish to even give you examples of ideas of programs that work. Overarching goal here is to unite the nation into this paradigm shift that moves us to a nation that embraces health and wellness through prevention and eradication of chronic disease, most of which is preventable, drives down the cost of health care while improving the quality and quantity of your life. So this document here and the summary that goes along with it kind of will give you ideas. You've got great health leadership here, and you've got great elected leadership here who understand the value proposition before us. So we're hoping that for those of you who haven't joined, please join us. Whether you're a small business, whether you're a big business, whether you're a government agency, whether you're, you know, the preeminent medical providers in the community, your 3 big healthcare centers, all of you, please take a look, join us. Let's see if we can move around this. This is a nonpartisan effort because we also feel no matter who becomes president, they're going to have to deal with this issue. And so I spent a lot of time traveling around with the candidates and their staff in trying to educate both sides as to how important this is to be able to improve the health of the nation and really move us to a healthcare system that is cost effective.